Welcome guys to my YouTube channel. My name is Nazan and I'm back to talk about infertility. Actually, when we talk about infertility, most people think that infertility only affects women. That is not the truth. Infertility affects both male and female. Kindly subscribe to my channel so that you can be able to know what are these factors that affect female and what are the factors that also affect male. What is infertility? Actual infertility is being unable to conceive after having unprotected sex for more than 12 months without using any contraceptive. Also, other people consider infertility as not being able to carry pregnancy to term. You are able to conceive, but you are not able to carry the pregnancy to term. You end up miscarrying. It's also considered as infertility. Infertility in women is approximately 20 to 35% of women who are affected by infertility, whereby in male it is 20 to 30%. You can see we have a very small difference in percentage, meaning that both male and female are affected by infertility. When we find these cases of infertility, it is always good for both couples to go for checkup so that we can be able to detect where the problem is and the treatment will be initiated. Infertility in men. There are several causes of infertility in men, and most of them are treatable while others are permanent. Some of these causes are low sperm count. You are considered to have low sperm count if per ejaculation you are ejaculating less than 15 million. Therefore, it is good to get treatment as early as possible. Another thing is what we call abnormal sperm. Abnormal sperm comes in whereby you are producing enough sperm, but their shape or they are abnormal. They are not able to swim and be able to go and fertilize the egg on time. There is a specific time whereby the ovum released and the sperm release should meet and fertilize. The longer it takes, the longer it's going to affect the fertilization. Therefore, there are some of the factors that will cause these abnormal sperms. Like if you are having a medical condition like diabetic mellitus, uncontrolled diabetes mellitus, it might affect the fertility. Those who are having some other condition like STDs and HIV, you are having chlamydia, and also what we usually say like hypospadia. You have a condition that is called hypospadia. It might affect also the shape of the sperm that is going to be produced. Also, if you have a hormone replacement, like testosterone hormone replacement, it affects the shape of the sperm and therefore affecting the swimming towards the egg. Other factors that affect the nene is cystic fibrosis and also illegal drug use. Especially this is more common in athlete or sport people, whereby they use a lot of steroid, and therefore it has some effect when it comes to fertility part. It is always good before you use any drug or before you do anything, you use any medication, it's always good to inquire from your physician to know if it has any problem, especially if you are on this area that you need to use steroids a lot. Also, smoking. I've always talked about it. It is everywhere. In every problem, smoking is there. In any condition, smoking. In cancer, it's there. In any other, most of the condition, smoking is an issue. Therefore, if you are smoking, it can also lower, or apart from just lowering, it can also has an effect on the type of sperm the shape of sperm you are producing. Other factors includes mental health. Mental health here comes in hand, whereby anyone, whether you are a man or a woman, but here now in men, when you are having mental issues, you are disturbed, you are stressed, you are depressed, you might not perform. Ejaculation becomes a problem. Ejaculation becomes a problem because this stress or this mental issue affect erection. Erectile dysfunction will also affect now ejaculation, and when you have poor ejaculation, you have low sperm count, it is definitely going to affect your fertility rate. Another factor is medication or treatment like chemo medication. I've always said, when you have been diagnosed with cancer, always ask your doctor if the chemotherapy medication they are going to give you will affect fertility. And I can tell you for free, most of chemotherapy affect fertility. Whether you ask or you don't ask, it's always good to take precaution, that it is your responsibility to talk to your oncologist that I have an interest of having a family in future, so that your sperms can be harvested and be stored somewhere before treatment starts. These sperms can be used to fertilize your kids in future. We have so many technologies like IVF and many other technologies that will help you have children without problem. But if you don't talk about it, most of chemotherapy will affect the sperm and therefore affect your fertility. Other thing is genetic disorder. Genetic disorder is whereby this is a familial thing. It is in your genes. Your family members have been having a problem to have children. Maybe you have an uncle, you have a relative who have had issues with kids. Let us not overlook and say maybe it was the wife or the woman who had problem. Also, it is good to go and check on yourself to make sure that you have good sperm shape and also you have good sperm count. Don't assume and say like, no, men, we are not affected. We are affected. Here we are affected. So it is good for you to consider if you have a family member that has been affected. We come hand in hand whereby surgery also has an impact. There are surgeries that are performed on testicles because of some reason like torsion and so on. If at any point you had trauma and you had to be done surgery, or rather you just had trauma and nothing was done or no more investigation was done, it is now always good if you have stayed in marriage with unprotected sex for more than 1 year and your wife is not conceiving, all of you, it's good to go for investigation so that they can try to find out actually where the problem comes in, because sometimes we might be traumatized and we get healed and we assume we are okay. If at a point you had trauma on your testicle or you had surgery on your testicle, it is always good to come out and speak like, I need investigation on this and this. Also, before you do any hormone replacement, also ask about it. What we call also hormone disorder. You have hormone imbalance, you have problem with any hormone that deals with fertility, it's always advised that you start getting medication or get doctor's advice on time. Therefore, if there is any condition that has been mentioned here and you feel like you have gone through it, it is always good to consider yourself as a victim or a person who needs help.